Hello, my name is Evan Coleman, and I am a part of the research staff with the HEALTH-RCMI. Today, we have the honor of asking CEO and co-founder of The Rose, Ms. Dorothy Gibbons, some questions regarding COVID-19's impact on cancer care.
Hello, my name is Dorothy Gibbons, and I am the CEO and co-founder of The Rose, a breast cancer organization that serves the insured and the uninsured and provides a whole range of breast imaging services.
Who typically receives breast cancer screenings?
The real sadness is that women without insurance, whether you're Caucasian, Black, Hispanic, doesn't matter. If you don't have insurance, you've got a 60% chance of dying from that disease, more than an insured woman. Now, that tells me a lot. See, one of the things we know as of last year, breast cancer became the most diagnosed cancer, surpassing lung, worldwide. I cannot say enough. Just because you're too young for a mammogram, just because you're under 40, doesn't mean you're too young to have breast cancer. So for all of those reasons, this should just be a part of your well-woman exam. And we all know we put these things off. Nobody wants to have a mammogram. Believe me, I know. I talk to women all the time. Oh, it's going to hurt, or oh, this, or oh, that. But you know what? Finding that cancer early, getting on with the options that you do have because we found it early, that makes it worth it.
You mentioned that mammograms can be intimidating for women. Could you describe the process of a mammogram?
What happens during a mammogram is that a woman's breast is imaged, very much like any part of your body that would have an X-ray, except that this is very low dose X-ray. It is performed primarily by women who are, doing an X-ray of your breast. It involves compression of the breast. And that can be painful, especially if the patient is near a period, near her menstrual cycle. The breasts get tender, and if you're compressing, it gets more tender. Dense breasts can often be extra tender. So, the whole imaging process then is sent to the radiologist who is reviewing the images. And with 3D, you're getting this continual picture of the breast. It's not just a 2D image, it's a 3D. And so you can see so many more indicators of breast cancer. The breast cancer has many indicators, from the shape of the tissue to calcifications to an actual lesion, an actual mass in the breast. So once the radiologist sees it and calls it either normal, come back in a year, or, I see something and I'd like to explore more, that's when you have a diagnostic workup. And that can involve an ultrasound. 80% of the times will involve ultrasound of the breast. Now, the one thing that we do is because the doctor is always in the room when you're doing a diagnostic or looking at the images in real time, then that woman's going to leave after that diagnostic procedure knowing that she's all clear, or that she's going to need a biopsy. And, I've always said women can handle most anything. Just don't make us wait forever for a result. And that's one of the things that has been such a change in mammography. After you've had that diagnosis, that diagnostic mammogram, what else is going to be needed?
Given what we have experienced since the onset of COVID-19, how exactly has breast cancer care been impacted?
There isn't any part of breast cancer care or imaging or treatment that hasn't been impacted by COVID. It's something like 94% of all mammography exams were not done in those first 3 months of that COVID started. And that was also the same for ultrasounds and also the same for MRIs. When you put this off, we have predictions right now that some 10,000 unnecessary deaths are going to happen because of the delays in getting screening or in getting treatment. So from imaging to diagnosing to treatment, all of those aspects were impacted by COVID. Well, I appreciate this opportunity to be with HEALTH-RCMI and to share these thoughts. This isn't coming from, your standard scientific mind. It's coming from experience. So again, thank you, HEALTH-RCMI, for having me on this program today. And stay tuned because there's a lot more webisodes coming your way.